Alia to share with us the 100-day agenda and the specificities. Again, folks right now are in listen-only mode, and if anything comes up or if you want to talk to each other via chat, that's all lovely. You can see each other in the chat box. Later in this presentation, we'll come on and turn it on Q&A, and folks will be able to raise their hands and ask questions. But if you have burning questions, please feel free to chat them into us. All right, take it away, Alia.
All right, well, thank you, Miriam. I'm really glad to be with everyone here today. So in today's presentation, we're just going to highlight a few of our policy recommendations, but we definitely encourage you to visit our website and read through our full 100-day agenda, which is going to be made available after this presentation. And that way you can just familiarize yourself with all of NAPAWF's policy points and recommendations. In addition to sharing with you NAPAWF's policy priority issues for the incoming presidential administration, we're also going to share with you the stories and voices of AAPI sisters who are directly impacted by these issues. So before we dive into our snapshot of AAPI women in the workforce, we have a short video that we'd like to share with you highlighting wage disparities. Great. So AAPI women occupy positions in economy, and some have succeeded in reaching the highest executive and management levels of their industry. Yet AAPI women also represent the fastest growing group of poor in the US, with 31% of AAPI full-time workers making less than $15 per hour. AAPI women are paid less than white men, leading to hundreds of thousands of lost income over a lifetime. As the video demonstrated, disaggregated data reveals that women from several Southeast Asian and Pacific Islander ethnic groups experience some of the highest wage disparities. For example, Bhutanese women make 38 cents to every dollar a white man earns. Additionally, millions of AAPI women are employed in low-wage jobs that offer limited or no benefits and are subject to workplace harassment and abuse. 46% of Asian American parents have no access to paid parental leave, and 37% of AAPI women workers do not have access to paid sick days. Again, the disparities within the AAPI community reveal greater discrepancies, with 55% of Marshallese women workers reporting no paid sick leave. Given this information, we urge the 45th president to develop and implement a plan to address economic insecurity among AAPI women and other women of color. A few key policy asks include supporting paid sick days and paid family leave policies that recognize that we are all better off when workers can take care of themselves and their families, created by blood or by affinity. We asked Congress to pass and enact the Pregnant Workers Fairness Act, which would require employers to provide reasonable accommodations for women who need them as a result of their pregnancies, childbirth, or related medical conditions. We urged the 45th President to support state and local efforts to enact living wage laws and to urge Congress to pass the Pay Workers a Living Wage Act and Paycheck Fairness Act. And finally, to direct the Department of Labor and the Equal Employment Opportunity Commission to prioritize equal pay analysis and data trafficking. While both agencies have already taken steps to improve the collection of pay data, such data must also be publicly reported and disaggregated by race, ethnicity, sex, and age on the national and state level. So before we jump into our next agenda item, we have Lang Lang here to share her immigration story. Thank you, Lang Lang.
Hi, good afternoon, everyone. My name is Ling Ling Chansey, and I am the Deputy Director of Systems and Sustainability here at NAPA. Back in 2014, our We Belong Together campaign, when NAPA is the co-anchor for, had a campaign called Fridays for Families. During this campaign, we actually asked families to take pictures of their dinner tables that showcase an empty seat at the table. Um, The dinner table is a place where people gather loved ones for food and shared experiences. And when a place at the dinner table is empty, the family cannot be complete. This campaign really hit home for me because there is always an empty seat at my dinner table. The empty seat at my dinner table is a daily reminder of the person who I miss the most, my older sister. My sister and I have not lived on the same continent for the past 25 years, and we see each other very infrequently. To fully understand my visa backlog story, you must first understand what my sister means to me. My sister and I are 5 years apart, and one of my first memories of my sister is of her carrying me in her arms and protecting me from some family feuds the adults were engaged in. The adults in my family will often be thrown in violent outbursts about money. One time, my sister and I walked in on one of those occasions. And on this day, I still have a vivid image of the broken glass coffee table and blood splattered scene. So many of my childhood memories consist of the overturned dinner table, but they are also tempered by the memories of my sister holding me and protecting me. Whether caring for me when I was ill or comforting me during tough times, she was always there for me throughout my life. When told that I'm not good enough, it was her that assures me that I can accomplish whatever I want to do in life, and she is my loudest cheerleader. On one of those very infrequent visits, we decided to apply for her green card, dreaming of finally being together again. However, as it stands today, it would take approximately take a total of 15 years before her application would be considered. My dinner table continues to be incomplete. I long for the day when I can look across my dinner table and instead of saying goodbye, I can say goodnight and see you in the morning. My story, unfortunately, is not a unique one. There are so many families like mine that are waiting to be reunited, waiting in the visa backlog system. Thank you.
Thank you so much. As Ling Ling said, she's not alone. In 2014, Asian immigrants constituted 30% of the country's immigrant population and are projected to become the largest group of foreign-born in the U.S. by 2055. Over 9 million Asian American women and girls live in the U.S., and those who are foreign-born enter the U.S. through various pathways, with a family-based visa, as the spouse of a worker visa, as refugees or asylum seekers, and as an undocumented individual. More than 500,000 AAPI women living in the U.S. are undocumented. A flawed immigration system separates AAPI women from their families. 6 of the top 10 countries with the highest backlogs are AAPI countries, and 40% of the 4.5 million families who are waiting in immigration backlogs are AAPI family members. Immigrant women are vital contributors to the economic and social fabric of our nation. NAPAWF believes that our country is strongest when women are healthy, safe, and able to care for their children and families. In order to support AAPI women, we urge the next administration to reclassify spouses and minor children of green card holders as immediate relatives, so they are not subject to the per country visa cap. To recapture previously unused visas to be applied towards current family-based immigration visa backlogs, and permit rollovers of unused visas to be applied for future flows. To end deportation of vulnerable immigrants and maximize the administration's executive authority to grant temporary relief from deportation until Congress passes legislation that creates a fair pathway to citizenship. And to also end enforcement programs such as Priority Enforcement Program, PEP. We encourage the administration to rescind the August 28, 2012 regulations and guidance that exclude individuals granted deferred action under the Deferred Action for Childhood Arrivals, DACA, policy from affordable health insurance options available to other individuals with deferred action. And finally, we urge the incoming president to direct Congress to pass the Health Equity and Access Under the Law, HEAL, for Immigrant Women and Families Act. The third policy area we wanted to highlight for you today is reproductive justice, which is critical for AAPI communities. This past year, we have fought relentlessly to ensure ensure basic reproductive rights for AAPI women and girls. Right now, we just want to share with you a short animated video that illustrates one AAPI woman's story that we'd like to play for you now. That story was one of many stories that we collected during our More to the Story campaign. NAPAWF believes that sexual and reproductive justice includes the fundamental right of women to have sovereignty over their sexuality, gender identity, and reproduction. 78% of AAPI women support the right to abortion in at least some circumstances. AAPI women, like all women, have been subject to increasing restrictions on reproductive health, especially when it comes to abortion access. Some of these restrictions have targeted AAPI and immigrant women in particular, and perpetuate ugly stereotypes about AAPI women and unfairly put their reproductive decision-making under scrutiny. Additionally, there are few studies that specifically document the reproductive and sexual health trends of AAPI women and girls, and even fewer that disaggregate the data by ethnic subpopulation. Yet the limited existing research reveals troubling disparities in healthcare access and health outcomes. For example, AAPI women are among the least likely racial group to obtain preventative reproductive health care services. Asian American women aged 18 and older are the least likely racial group to get a Pap test, despite high cervical cancer rates among certain Asian subgroups of women. Sovereignty over one's body and reproduction also includes the right to live free from violence. Due to inadequate data collection and underreporting, rates of domestic violence and sexual assault in the AAPI community are inconsistent. It's estimated that 41 to 61% of AAPI women experience intimate partner violence. And AAPI women also report family-based violence, sex trafficking, and assault. To address these gaps in reproductive health services and care, the administration should issue a statement condemning so-called sex-selective abortion bans, call on Congress to support the Equal Access to Abortion Coverage and Health Insurance Act, the Each Woman Act, and call on Congress to repeal the Hyde Amendment and the Helms Amendment, issue a task force to release a comprehensive report on violence against AAPI women, and support the allocation of funding through the Office on Violence Against Women for culturally appropriate violence prevention and intervention initiatives. Finally, we'd like to highlight our other administrative priority recommendations that span across NAPAWF's areas of interest. First, we ask the incoming administration to make the marginal investments necessary to coordinate and fund adequate data collection and research on AAPI communities. A common thread across all issue areas is the lack of disaggregated data on AAPI communities. The President should create a special commission to study and report the impact of federal economic justice, immigrant rights, and reproductive justice policies on AAPI communities. We also ask the new administration appoint progressive AAPI women to each federal agency. To ensure federal programs and policies advance opportunity and well-being for all women, progressive AAPI women must be part of the leadership team tasked with making and implementing regulatory reforms. In addition to cabinet-level positions, AAPI women's leadership is needed throughout governmental agencies. We also urge the President to nominate qualified Asian American women judges. It is necessary for the incoming President to unequivocally denounce Islamophobia and eliminate programs which profile people by race, ethnicity, or religion. Muslim AAPI women should be able to practice their religion without fear of harassment, profiling, or violence. US DOJ can and should set an example of this by prohibiting profiling on the basis of ethnicity or religion. And finally, we urge the President and incoming administration to center the needs of low-income women and women of color. While recommendations presented are categorized by broad issue area, AAPI women know that our lives are never single issue. The President should establish intra-agency mechanisms for the intersectional issues of low-income women in their full complexities. So now that we've laid out our priorities for the first 100 days of office, I'm going to pass it back over to Miriam to tell you how you can continue to stay engaged.
Thank you so much, Alia, for reviewing that. That's a lot of information and really terrific priorities outlined. We also know some of these are asks that are congressional or legislative in nature that can be done federally or locally. So our hope is that this new document, this 100-day agenda that we're publishing, can be useful for you in your work in your local communities. One, you can direct them to your federally elected representatives and help us advocate for the need of laws that could be changed. We also encourage you to share these policy recommendations with your friends and colleagues or organizations that you're a part of so that we can create an echo effect and really join each other in pushing for these agendas. We, of course, are going to continue to work hard in DC through our coalitions and networks to push for these recommendations and also push for the right people to be in the new administration. So that comes to my next big ask, which is if any of you are interested in serving in the next administration, we really would love to help support you in going through a process of getting an appointment position. We definitely need good, strong RJ advocates, women of color, folks with the experience of growing up as immigrants or coming from immigrant families to be driving the policy change that we expect this next president to make. So if you want to discuss what it's like to work in government or to get an appointment process or already know you're in for it, I think reach out to Alia. Her email is right here on that slide. It's acon@napawf.org. But NAPAWF is sitting at a number of appointments tables, and what I'm hearing is that everyone is invested in making sure there are progressive women of color represented throughout the next federal administration. Lastly, of course, we're not exactly done with this horrid election, but we are close. And for some of you who live in early voting states, you've already voted, which is terrific. For many of us without early voting, this can't be a more critical reminder, which is for us to all make sure we go out to vote. And you should have received in the mail, if you're on our mailing list, a paper copy of our voter guide in English that we just released this week. Voter guides are also available on napawf.org. And this year we've translated, this, by the way, is the first ever national AAPI women's voter guide. And online you can find our translated voter guides in Korean, Chinese, Vietnamese, and Hmong. Our hope is that you'll talk to your moms, your aunts, your cousins, your grandmas, your neighbors, and encourage them to vote on the issues that are important to AAPI women and girls, and to vote with the values that we hold most dear. So please go out, get your copies of your voter guide, and share them. We hope this voter guide helps you talk to people and open up a conversation about why it's so critical that they get out to the polls on November 8th. All right, so that concludes our organized portion of our presentation. We are turning on Q&A mode now, so if you have any questions or comments or follow-ups, all you have to do is push a little button that says raise your hand, and then we'll be able to hand the microphone to you. Or you can type into the chat box any comments or thoughts that you might want to share. How do we'll see if someone's raising their hand. Okay. Someone humor me and raise their hand so I know the technology works. Any questions, thoughts, observations? Great. Heady trip. You might be connecting with your audio right now. I think we're still waiting to connect to your audio right now, Hedy. Hopefully the computer will line up quickly. Thanks, Joy, for that message. We're pretty excited too about how far we've come. While we wait for Hedy. Hedy doesn't seem to be working. Let's try in a little bit. So take back, and I know Satyam. Satyam, did you have your hand raised?
I think she was doing it to test.
Oh, okay. Hedy, do you want to type in? And then if anyone else wants to raise their hand and be given the microphone, we can try that again. Particularly if there are no questions from the audience about what we've presented, this is a convening that we mostly targeted our membership base and our chapter leaders with, I'd love to hear from folks how they can imagine this 100-day agenda being useful in your work and in your conversations.
Also, would you like to speak? I think Satyan brought up sharing about how we came up with this set of priorities, which I'm sure people are curious about. Would you like to share that, Miriam?
Yeah, so folks know we have pretty long and very detailed immigrant rights agenda, reproductive justice agenda. We have an economic justice agenda, which we're about to release. And we've had an anti-trafficking agenda that was written in 2008 as well. And within those agendas, which are really comprehensive analyses of the issues and how they impact AAPI women and girls, we also came up with policy recommendations. In total, I would say there are about 300 or 400 policy recommendations we've identified through those agendas. So what we did for this is that we gathered with our sisters from across the country, taking advantage of the opportunity to do in-person conversation through the United Summit on Women, and thought about what are, the deepest and biggest needs that we see in our community, locally and nationally, and also, two, what are actually things that are impactful that could potentially be moving, right, in the next administration? What are campaigns or issues that we feel like have legs? That our voice could be a tipping point voice or an analysis that could really help, apply more pressure to. And then thirdly, we also took a look at the kind of gender justice and women's rights field most broadly and thought about what are places where API women's voices are most needed, right? Where our analysis has been largely invisible, but we feel like we could really impact the discussion and conversation. So through a calculus, looking at those number of things, our group came to a consensus about these being the kind of most pressing issues that we saw. Thanks, Heidi.
Other thoughts or questions or ways that you think you can integrate this into your own work?
Yeah, would love to hear from that. And also Kat wrote in the appointments process. Yeah, other groups are submitting names. We definitely are leveraging our relationships. In particular, we have access to folks in the LGBT movement who's doing an appointments process. We are part of the table that is building the first ever repro rights, health, and justice appointments process. And I'm also working with NCAPA, the National Council of Pacific Americans, to reconstitute the API appointments table as well. So those are the three that we have most intimate relationships with. But as you know, NAPAWF has sisters throughout the social justice field. I imagine folks who are really interested in maybe an unrelated field like, DOL, or if you want to work in energy, or if you want to work in ag, I'm sure I'll be able to find a connection for folks. Thoughts about the appointments process? More questions there?
We have a question from Janine.
Yeah, Janine's question about how and if trans and queer API people were specifically integrated into the policy recommendations. The convening that we brought together was diverse in terms of region and age and ethnicity, sexual orientation. Well, admittedly slightly less so in terms of gender identity. I don't think anyone identified specifically as transgender. But as with all of our policy recommendations, they are reflective of the folks who come to the table and help us craft it. and also are reflective of NAPAWF's values, which have always been inclusive of our trans and queer brothers and sisters. NAPAWF as an organization has always been about self-identified AAPI women and girls, and also those on the non-gender conforming spectrum who believe in our mission, which is to build a movement of social justice and human rights for AAPI women and girls.
And also the policy asks are things that, we really believe are going to further and improve AAPI communities, families as a whole, right? And so going through some of those policy points and policy asks, I think are recommendations that are really going to be able to holistically improve and further the movement for AAPI women and girls, as well as for trans and queer folks too. And we have greater, more in-depth pieces coming out around RJ and around economic justice as well, to look out for those.
Yeah, and then this week, Ali and I, or was it last week? No, it was this week. Ali and I were just part of the table that created the blueprint and agenda for LGBT youth. And I think what is remarkable is that not only were we able to import some of our asks into that blueprint process, but I would say there was a lot of alignment from what we saw in the LGBT youth asks as well. So, we are definitely bridging between the different policy silos that exist there.
We have a question from Jojo, Miriam.
Yeah, so Jojo, where in the US are APIs the fastest growing poor? It's interesting that one, this is because APIs are just generally the fastest growing racial demographic. And two, if you look at the pattern of which APIs are coming over the fastest, they tend now to be more South Asian and Southeast Asian. So Pakistani and Bangladeshi communities, for example, topped the list in terms of population growth. In terms of poverty density, API poverty still is largely densest in the cities, in the major metropolitan areas that are traditional gateways for AAPIs. So here in New York City, New York City is actually home to the largest community in pure quantity of poor APIs. But I would say that the growth is everywhere. And just like we're seeing that the growth of where APIs are moving is actually into the middle of the country, states like Nevada, North Dakota, Georgia, Pennsylvania in the South, we're gonna start seeing those numbers shift. And Jojo, to your point, I think part of it is driven by refugee communities, although those numbers are lower than actually other communities that are coming, and it's really where folks are coming from Asia, and what their circumstances are. The majority of Asian Americans come through family visas and somewhat through work visas, but the work visa pieces still tend to prioritize high-skilled labor, right, and better paid labor. So that's not actually the driver. It's largely the family immigration system, I think, that's driving it. Great. Other questions or thoughts or follow-ups to anyone want to raise their hand and take the microphone for a second? Would love to hear people's voices. Oh, Hetty. Let's try again. Let's see if this works, Hetty.
No.
There you go.
Can you hear me?
Yes.
Oh, all right. Very good. Okay, the popular issue right now is college sexual assault on college campuses.
Yeah.
And I know what you allude to in terms of violence against API women speak to that. But I wonder if we could also highlight that somewhere, since it is a so-called popular issue right now.
Yeah, that's a great point. We did discuss, especially because there's such a renewed focus on sexual assault, and certainly President Obama had prioritized work around campus-based sexual assault, and because there is disproportionality around sexual violence against AAPI women and girls. So we hear that. We'll take that back and see what we can do to build it in. The timing around June, of course, it wasn't as on top of people's minds, right, when we were convening the drafting committee. But I do hear you, Hetty, about the opportunity at hand.
I think also the piece around trying to get disaggregated data and making sure that one, that they're collecting data
Yep.
to be able to represent AAPI communities, and then also disaggregating that is really important, particularly around sexual assault on college campuses, because oftentimes those numbers aren't reported, and so then it makes it harder for us to kind of leverage for change. And so those pieces, even though are they seem separate, really that piece around trying to get accurate data collection is so important to be able to advocate on behalf of AAPI folks.
Yep. Great. Any other thoughts or questions from the attendees? I love it. People are sticking it out through Q&A. Barely lost anyone. All right. If there are no further thoughts or questions, you should expect these priorities to be posted on our website in 45 minutes or so. This presentation is being recorded, so we will share the link out with chapter leaders at our next chapter leader call. And I thank you all so much for taking some time out today to attend this webinar and to make this process a success. I think as we continue to build power for AAPI women and girls, we are so looking forward to partnering with you and amplifying your voice and your stories and making sure that our next president really centers our lives in their work. So thank you all. We'll be available for feedback or private conversation as folks leave. If you want to hang out and ask us or talk to us more, we'll be hanging tight. But thank you.
And definitely go to the website and get your hands on that full version of the 100-day agenda. And as questions or thoughts come up, as you have more time to kind of dive into that document, feel free to reach out to us.